everyone. Today we are honored to host Dr. Lindia Willies-Jacobo, who currently serves as the Senior Dean of Equity and Admissions at the Kaiser Permanente Bernard J. Tyson School of Medicine. Before this, Dr. Willies-Jacobo was on the faculty at the University of California, San Diego School of Medicine, where she served as a professor of pediatrics, the Assistant Dean for Diversity and Community Partnerships, and the Director of the Program in Medical Education, Health Equity. Dr. Willies-Jacobo has received numerous teaching, faculty service, and diversity awards. Her scholarly interests include healthcare workforce diversity, cultural humility in the practice of medicine, advocacy for underserved populations, and combating health inequalities. Thank you for joining us today, Dr. Willies-Jacobo.
Thank you so very much, Madeline. It's an absolute privilege to be here and to be with all of you. And if it is okay with you, I will go ahead and share my slides. Can you see this with no difficulty? Wonderful, great. Yes. So again, thank you. And it's a privilege to be in this space with all of you. And we also have Ms. Agasia Lanier here in the space, who serves as an admissions counselor at our school and is the lead person on our recruitment efforts. So Agasia will be able to help out with responding to questions at the end. So what I thought I would do today is speak with you about the admissions process at Kaiser Permanente Bernard J. Tyson School of Medicine, and also tell you a little bit about the school itself. And again, we should have plenty of time toward the end for Q&A. I thought I would begin by sharing a little bit about the location of our school. We are in Pasadena, California, which is a little bit of a small town within the larger Los Angeles proper. And we are located right at the corner of Los Robles Avenue and Green Street. And I've been at Kaiser Permanente School of Medicine now for a little over 3 years. I arrived in December of 2018. And prior to doing that, I was at UC San Diego, as Madeline pointed out, for about 30 years. And I say that to say that I thought I was going to finish my career at UC San Diego, but when this opportunity arose, I jumped right at it. And it really was the mission and vision of our school that spoke to me. I felt and continue to feel that it's incredibly well aligned with my personal and professional values. So just sharing a little bit about the mission of our school, beginning though with the vision, and lots of words here, but one of the main things I did want to share is that in terms of our vision, there is this amazing opportunity to graduate a diverse community of compassionate healers, lifelong learners, and courageous leaders of change within the profession and in society. So we know that students coming into our school are going to be at very different levels in terms of, their leadership skills, their advocacy skills, but we're really looking for students who are deeply committed to those issues. And likewise, the mission of our school, we often forget that medicine at its very core is a profession of service. And so service to our school is absolutely foundational. And I'll show you a little bit of that a bit later in the presentation. This photo was taken on July 26th of 2020 when we opened our doors. We often say that we were ready for everything except a pandemic. So you'll note that this was our welcome ceremony for our students. We are all distanced and we are all wearing masks. So we recruit and we admit, I should say, we matriculate about 50 students per class. And our students train in a distinct integrated health system that is Kaiser Permanente. And what that means is that the way that our students learn doctoring and medicine is that when a patient comes in to the clinical environment, the clinical site for any reason, all of their needs are taken care of. So if you broke your ankle and you go in to see an orthopedic surgeon, the chances are you're going to be asked if your immunizations are up to date and other areas of your health screening, whether that too is updated. We also want to highlight that we support our students in any field that they choose. I think when we initially advertised our school and opened our doors, there was an assumption that we were we're primarily interested in training students to be primary care doctors. And I'm a pediatrician, a primary care doctor, so I may be a little bit biased, but do know that if you decide to become an ophthalmologist or, an OB/GYN physician, we will support you and ensure that you get to where you need to be. And likewise, at our school, we are not a pipeline to the larger Kaiser Permanente system. We know that many of our students may want to remain at Kaiser Permanente, but once you graduate, you can do your residency anywhere in the country. And in fact, we want you to utilize the model that you're learning at the school and take that with you to other institutions. We have 100 students enrolled currently in our school, and again, very, very diverse institution. About 38% of our students are coming to us from an underrepresented or underincluded in medicine background. Our mean age is about 24 years old. We don't necessarily have a preference for in-state versus out-of-state, as we are a national school, and Kaiser Permanente exists in about 8 regions across the country. A little over a third of our student body are coming to us from a socioeconomically disadvantaged background, and about 20% are first-generation students. That means that they are the first students in their families to go to college. So we are really incredibly proud of our demographics. When I came on to Kaiser Permanente in 2018, having been at UCSD for so long, I had a very steep learning curve. And some of what I learned is that we've been around for quite some time, from about the mid 1940s. We are one of the nation's largest not-for-profit integrated healthcare system. So the Mayo is the other large integrated healthcare system. We have lots and lots of patients. They're called members. So about 12 million folks are served across 8 regions. And one thing to know about Kaiser Permanente is we are considered among the highest ranked health plans for quality of care across the country. As I mentioned earlier, we are in Pasadena, California. When folks hear Pasadena, they think of it's kind of the home of the Rose Bowl and the Rose Parade. But as you know, we're also nearby educational and scientific institutions. And for us as a freestanding medical school, meaning that we are not associated or linked with a larger university system, it is nice to have schools like Caltech right down the street from us. Likewise, being in Pasadena, lots of hiking for those who enjoy the outdoors. And we're also very, very close to downtown LA. We recently had our medical students actually went out to one of the local parts in Los Angeles where we had kind of a narrative medicine indigenous ceremony, which was a wonderful opportunity for our students. And then we're, again, loving the outdoors. We're close to the beaches. We're very close to ski slopes, to the desert. So lots to do. And for those who prefer being indoors, lots of wonderful museums as well. A little bit about the leadership at our school. Dr. Mark Schuster has been at the school for 4.5 years. He came to the school in October of 2017. He too is a fellow pediatrician, so I may be a little bit biased, but it's been a privilege serving alongside Dean Schuster. He is an international leader on all things health and public policy. So if you ever have an opportunity to read his writings, I would encourage you to do so. And then this is our more expansive leadership team. And I show this to remind myself to share with you that our school was really built on the foundational principles of equity, inclusion, and diversity. And although with one photo, you can't see every layer and every dimension of diversity, I think this at least gives you a sense of racial, ethnic diversity, and perhaps some gender diversity. But what I will say is that, every single person on this screen brings with them a whole host of attributes and qualities. And it's an incredibly devoted group of leaders who I've had the privilege of serving alongside. A bit about our educational approach. Unlike, I think, many institutions across the country, we have three pillars or three departments. The biomedical science department is the one whereby students really learn kind of the basic sciences that are important for clinical reasoning and decision making. Our clinical science department, which is a large department consisting of physicians from a variety of specialties, is where students really learn about prevention, they learn about diagnosing and treating health conditions and disease. And then this third department or third pillar is often overlooked at other institutions. I think we were the first health system science department in the country. I want to say there may be a total of 2 to 3 since we've started this department. But this is where students really learn how human relationships are organized in systems, which we know does have a significant influence on health. And it really is where students learn a lot about health equity and ways of improving health. And just a few high-level overview of our medical education approach. We are a non-lecture-based school. And what that means is that we do all of our teaching and learning in small groups. The learning happens based on cases. We try to make them as real life associated as possible. And then a lot of our learning also happens on teams. We've engaged augmented reality in our anatomy teaching. You'll note the student has a pair of HoloLenses on, and he's made a cross-section through the heart. You can actually see the heart beating. And you can also note that the student's partner has also a pair of HoloLenses, and we've added X-rays and different forms of imaging to how we teach anatomy. Our students begin in the clinical environment very early. They start learning by about week 3, and these are called longitudinal integrated clerkships. In the first year of medical school, the students go to one of these 6 medical centers, and in the first year, they are paired with either a family medicine doctor or an internal medicine doctor, and that's for the entirety of the year. And then during the second year of medical school, our second year looks like the third year of medical school at most other medical schools. So students are doing what's called their core clerkship rotation. So in addition to being paired with a family medicine or an internal medicine doctor, the students are also going out to do OBGYN, they're doing surgery, psychiatry, as well as pediatrics, and they typically on the weekends will have a few emergency medicine rotations or shifts. Wanted to give you a little bit of a sense of the kind of the demographics of the 6 medical centers that our students go out to. And you'll note that depending on the site, the demographic shifts a little bit. But it's important to note that what we did preceding the arrival of our students is try to ensure that we were identifying medical centers with a significant amount of diversity across the board. Also wanted to ensure that folks understand that equity, inclusion, and diversity is really embedded across the entirety of the institution. I oversee the office, but with a lot of amazing support from that office, including having a director. We have a pathways or pipeline coordinator, so very robustly staffed office. Our recruitment of our students is intentional. We also try to ensure that we are developing our curriculum through an equity, inclusion, and diversity lens. All of our cases that we utilize for teaching undergo what we call an EID review, where we're checking for biases and stereotypes and that sort of thing. So it's just an amazing job that the team does. And then we also have specific equity, inclusion, and diversity sessions that are embedded throughout. The students learn about microaggressions, they learn about biases, and we have a pretty robust anti-racism curriculum as well. I mentioned earlier that our school was also built on the foundational principles of service. We often forget that medicine at its very core is a profession of service. And all of our students go out to a federally qualified health center, which ends up being in the exact same community as their longitudinal integrated clerkship. So for example, if the students are going out to Downey Medical Center to see patients, that federally qualified health center that they're doing a lot of their service learning at is located again in that community. If they're going out to Los Angeles Medical Center, they will be based at the Wesley Health Center for their service learning. In addition to having a service as foundational to the school, every student will have a service learning project that they need to turn in at the end of their 4 years with us. Our students also have a scholarly project or a research project that they're all responsible for turning in at the end of the 3rd year of medical school. We really want students to have stuff to talk about when they go off during their 4th year for their residency interview. So we've asked them to finish up their scholarly project a little bit earlier. We've tried to really normalize academic support and well-being at our school, and our students are asked to meet with a psychologist, which is on site at least twice during their 1st year of medical school. Every student is also paired with a physician coach for the entirety of the time they're at the medical school. And then we ensure that they're meeting repeatedly with our academic support office in order, again, to ensure that they're getting that support before they get into any form of academic trouble. I mentioned that well-being was also foundational to the work we do at the school. And we have a course as well as a program known as REACH. It stands for Reflection, Education, Assessment, Coaching, and Health and Well-being. And this is a 5-module learning series that students are engaged in. It happens 1 quarter over 1-week blocks throughout the 4 years that they're with us. And it's really a time for students to explore ways to maximize their resilience skills, engage in well-being practices, learn new ones. And ultimately, they're really working on defining their professional identity as future doctors. I wanted to highlight a little bit, I talked about our learning occurring primarily in small groups and on teams. And I just wanted to point out that in order to be successful in that, with that level of team-based learning, our students have to do pre-work. They have to do some work preceding their arrival to the classroom. And one of the things I wanted to highlight on this particular slide is that they do have quite a bit of independent time, and that was very intentionally done. We really do want to ensure that they have enough time in the afternoons in order to prepare for the subsequent day of class. Wanted to also highlight that we currently have 3 dual degree programs. The first is an MD PhD program in partnership with Caltech, which I mentioned earlier is right down the street from our school. We also have an MD MPH program, a Master's of Public Health with UCLA, and a Master's of Health Administration with USC. So if you are somebody who's interested in getting that dual degree, this would also be a good opportunity to be at our school. And I should point out that these are, you can think of these as 5-year dual degree programs. The master's portion of the program is a 1-year master's program. The MD PhD program, of course, would be a whole lot longer than that amount of time. We also have significant tuition remission. We provide full tuition and insurance coverage for every member of our very first 5 classes. So that means that anyone who matriculates to our school in 2020, 21, 22, 23, or 2024, you will get the entirety of your education, the full tuition covered. So that's, I think, an important aspect of the school. And what that allows us to do is ensure that our students are selecting specialties not based on how well they're going to be remunerated by those specialties, but instead based on the kind of doctor they really would like to become. And then we know that living in LA and Pasadena, it's quite pricey. And so we do have a pretty generous grant aid to offset living expenses. So a little bit about the admissions process, and I always like to begin by sharing, and this is for the 2023, the upcoming cycle. I usually like to begin with a timeline so that people get a sense of some of the stuff you would want to begin to do before you apply to med school. Usually around this time, you're kind of checking out different med schools. If you're not yet ready for the MCAT, that's when students are taking their MCAT, they're requesting letters, etc. So again, I'm happy to share this deck if it would be helpful, just so that people get just a general sense of kind of the timing of medical school. These are the admissions requirements for our school. We have prerequisite, meaning that the courses on the left are required courses and the ones on the right are recommended. And I think these look quite similar to those of other medical schools. I did want to highlight at our medical school, we have a medical humanities, narrative medicine. There's a lot that happens in that space at the school. So we have made it a requirement for students to have done some amount of humanities, meaning that can be satisfied by way of taking courses in art, English, history, literature, philosophy, and many other courses. And then the recommended courses, we know that schools are all still requiring the MCAT. At least 97% of medical schools are still requiring the MCAT. So ensuring that you've taken organic chemistry, biochem, etc., that would be important. I mentioned earlier that we have a health system science department, which is where a lot of issues of statistics of population health, etc., are covered. And so we typically recommend that students have some level of comfort with public health types of courses. In terms of the application requirements for 2023, these are all posted on our website. We want students to have a bachelor's degree from an accredited college or university in the States or Canada. Our applications are through the primary application system known as AMCAS. And then our secondary application fee is $50 currently, although we do waive those fees for any student who qualifies for the fee assistance program through the AAMC. In terms of letters of recommendation, requirements are 3 to 6 letters. We also do, though, accept packets of letters. Schools will sometimes have, pre-health letters that students are then able pre-health advisory letters, I should say, that students are able to submit. And then our interviews are what we call a hybrid model. And that means that not only do we conduct a 29-minute one-on-one traditional interview, but students also will be rotating through different stations by way of multiple mini interviews. And then we are likely to have interviews, to host interviews in person for the 2023 admission cycle. We know that case rates of COVID-19 are diminishing, and as students are getting back to the classroom and things are, happening more in person, we too are trying to follow suit with that. A little bit about how we evaluate our candidates, because I know that this is often a question we get a lot. I know Agasia gets it a lot when she's off doing office hours or hosting our monthly information sessions, but we use something known as the holistic model or the holistic approach. And you'll note on the right, we really are looking at a student's lived experiences, their attributes, and their academic metrics, meaning GPA, and MCAT, meaning if you've attended community college, we're also looking at the entire trajectory, the whole course of your studies, okay? And we try to weigh all of those pretty equally, right? So we're not looking at academics so heavily that we're ignoring your lived experiences, all of your many attributes, your what we call your distance traveled, right? So this is a holistic approach. It's utilizing an equity lens or framework. And then on a more granular level, we often get asked, well, what kinds of students are you looking for at the school? And I started by saying that we are a non-lecture based school. So we're really looking for students who really enjoy small group active learning. They're willing to be good team players. They exercise really good critical thinking skills. We also know that we are a brand new school, and so we're looking for students who are mature, students who are adaptable, students who are kind of on this journey with us, who will co-create our curriculum and all aspects of the culture of our school with us. I should also highlight that I shared earlier that students begin in the clinical environment very early. So having a full appreciation for being in the clinical setting by the time you're a third week medical student, right? You have to really want to engage in that way. And then we also often remind folks the desire to become a lifelong learner, although it's not unique to the school. This is an important attribute or feature of becoming a successful doctor. So I wanted to share a few tips with you, which I hope will help you with simplifying your journey. And we know that everyone's journey looks a little bit different. We all start at different places in that journey. So as you are getting ready to apply to medical school, I think it's important for you to review the mission and vision of every school to which you're applying. The AAMC has wonderful resources, and we also know that there's studentdoctor.net and any number of other ways that pre-med students get their information. But I think if you stick to the AAMC's website, you'll get a lot of rich factual information in preparation for your journey. Also make certain you are reviewing the website of the schools that you're most interested in. You want to ensure that your professional and personal values are aligned with the mission of those schools. There's a lot that floats around regarding when you should take the MCAT, and we feel strongly that you should take the MCAT when you feel ready. I can't emphasize that point enough. And some of the ways you're going to know whether you're ready or not is by way of, your studying. How is that going? By way of taking practice exams. I often encourage students in discussion with their mentors to ensure that you have at least a target score, because it's nice to have something to work toward. And that actually allows you to measure your progress. When you're asking for letters, make certain you give your letter writers advance notice, and make certain you're asking for a strong letter of recommendation. We read thousands of letters every year, and it's sometimes clear when a student didn't, kind of say, are you able to write me a strong letter? And you really want to get that particular commitment from the letter writer. Don't be afraid of sending friendly reminders. But again, I think the most important thing here is to ensure that you're providing your letter writers with enough advanced notice. Once all of that is together and you are really feeling ready to apply to medical school, make certain you're doing so early. The earlier you apply, the more likely it is that your application is going to be reviewed early. And then that also means that you get to get invited to interviews early as well. The fifth tip I would like to share with you is to keep an updated list of your accomplishments and experiences. You really want to reflect on, all of these experiences that you've had over the years. And again, I think for every individual, that's going to be a little bit different depending on your starting point. And once you've listed those meaningful experiences, you do want to try to get letters of recommendation from any experience that felt that it was deeply meaningful. And then the last tip, whenever you're ready to apply, is to make certain you're keeping your personal statement simple, keep it clear, keep it purposeful. And as importantly, please make certain you're asking someone to read it. You're reviewing it for grammar, you're having folks review it for content, for flow, for tone. Incredibly, incredibly important. So with that, I am going to, I think I'll stop sharing my screen. And here we go, stop sharing my screen. And I am happy, I think we will have plenty of time for questions and to engage with you. So I'm happy to take any questions you may have. Thank you.
Thank you. Our first question is, what do you think is the biggest or most important thing that sets Kaiser apart from other medical schools?
I think that's a wonderful question, and I can give it a stab. And Agasia, if you would like to speak into this, please feel free to do so. I think there are a couple things that really make our school distinct. I would argue that I'll come back to its commitment to well-being and that sort of thing, but I will say that our health system science department is quite distinct. I think that when you look across the country and look at the different ways the curricula is put together. There are few places whereby the content that we've put together in health system science, for example, a lot of that stuff is often covered in electives and selectives at many medical schools. And I think we've had an opportunity as a brand new medical school building from the ground up. Again, we've had a lot of wonderful help from other medical schools kind of discussing with them best practices, what works well, et cetera. So we are really in kind of this unique position whereby we were able to build out an actual health system science department that focuses on health equity. I think that's a pretty distinct aspect of the school. And then the last two things I'll speak into is kind of this deep commitment to EID, to equity, inclusion, diversity. Not just saying that we're deeply committed, but demonstrating that it really is folded in and embedded in every aspect of the school. And then the commitment to well-being. I think any student you talk with, and I think staff and faculty feel quite similarly, it's quite a highlight at the school. And I don't know, Agasia, if there are other aspects that you feel are distinct about our institution.
Funny, I actually answered this question earlier today in another panel. I pretty much listed, I think the Anatomy Resource Center is a really something that really sets us apart from other institutions. And our resource center, in other words, we do not have a cadaver lab. Our students learn by way of virtual reality, simulation. They also are using human specimens. They're called plastinates, and they're human specimens that are pre-dissected in plastic form, which allows our students to work with that particular specimen for years to come. So I think that's something that is the highlight of our school and something that sets us apart. I also pretty much highlight the fact that we do offer all of our students within the first cohorts free tuition and free health insurance. So I know that's pretty big for a lot of people. So I think those are two big things that sets us apart.
Thanks, Agasia.
Great answer. Our next question is, during the longitudinal integrated clerkships, what kind of things are med students able to do / be involved with while in the clinic?
Great question. I'm assuming, Madeline, those are the longitudinal. Did you say longitudinal? Got it. Yeah. So that is a wonderful question, because if I were a student hearing this presentation, I would think to myself, well, how does a student who's been at the school for 3 weeks, how can they possibly engage in a clinical setting? And frankly, part of the reason they actually are seeing patients, they are getting histories, performing physical examination, and beginning to go through clinical reasoning in terms of coming up with diagnosis, et cetera. And the main reason they're able to do that is every Tuesday morning for 4 hours, we are working intensely with our students in our doctoring course. Okay. And what that means is that we are either in the classroom going through a whole host of cases, learning kind of the critical aspects of taking a history, performing a physical examination, also going down to our simulation center where we are having our students work with standardized patients. So we do a lot of upstream, deep learning from a doctoring perspective so that when the students go out to clinics on Thursdays, they are applying the skills that they're learning in the classroom in the clinical environment.
Thank you.
Mm-hmm.
Our next question is, what are some of the current scholarly projects that students are working on? Could student scholarly projects focus on medical education or health disparities or health system science projects?
Yes, great question. All of the above. And we recently, I think it's been about 2 weeks now, we had something called a data fair. And our Office of Research and Scholarship just got this incredibly rich data that students can now begin to do data mining on. And some of our students are doing that. I know that we have a couple students working on projects looking at the cardiovascular effects post-COVID. For example, we have students looking at disparities as it pertains to diabetes. So lots and lots of activity happening. So those are just a couple examples. But I should point out that there's a lot of flexibility in terms of the kinds of projects students can be involved with. One of the areas our Office of Research and Scholarship works on pretty intently is pairing our students with mentors, with research mentors, so that students are guided from the time they get to the school, and they actually are, Dr. Finkelstein meets with students routinely to get a sense of the kinds of projects they are interested in. And based on those interests, they are then paired with mentors. So there is a lot of support for our students who are, interested in research, but I should point out they're all interested in some form of scholarship. And as I said earlier, it is a requirement for the students.
And our next question is, does the medical school require applicants to complete their physics series at the institution they attend?
Hey, Geisha, you want to take that one?
Actually, I really wanted clarification on that. I tried to answer that a little earlier, and I wasn't really sure with this particular question. Could you clarify this question?
What I'm assuming is, I think they're asking if it's possible to take it maybe at a community college over the summer instead of their 4-year.
That's perfectly fine. All we really want is that you have completed the equivalent of a year in physics. So whether you took, the first class at your community college and your second series of that physics course at your college, your university, that's okay, as long as it was with the lab and it was from an accredited school.
I think that answers it.
I hope so.
And then our next question is, does taking all of your pre-med requirements at a community college look bad?
Not at all. No, I think that's a pretty firm myth out there that, if you went to community college, you can forget it because, if you did OChem or biochem or what have you. And, I hope if you remember nothing else, please remember that those courses are honored just like it's taken at any other institution. So.
It's definitely good to hear. Our next question is, do you think that Kaiser will increase their class size in the upcoming years?
Great question. So one of the things we, this week, in fact, we had our provisional accreditation visit. So as our dean would say, we are as far in the accreditation process as we can be. And so we are not yet considering increasing our size. And in fact, we have to remain at 50 per class, at least until we get full accreditation, which will be in 2024, 2025. At that point, there may be some consideration of increasing by a few per class, but in the foreseeable future, we're holding tight at 50 per class. And I will say that right now we have 100 students. We'll be bringing in another 50 within the next couple months. And, you know, the building that we have feels wonderfully intimate. And I think one of the things we've enjoyed a lot at the school is having that small class size and really having the opportunity to know our students really, really well. So I think for now we are going to be holding tight.
And our next question is, I'm a DACA recipient. Can you elaborate on the resources / support that is available for students like me? And along the same line, will I be eligible for the financial aid provided?
Great. I don't know, Geisha, did you want to start that one, or I'm happy to start? Or
I would say start.
okay, I'll go ahead and start. So, you know, I should highlight that, you know, as a DACA recipient, we really do hope that you will apply to our school. We have a couple students who are in fact DACA recipients. They all have been provided with full resources and financial support. And so having DACA status in no way has affected them negatively in terms of being at the school. And I will say that we have a whole host of, you know, support structures at the school, including a whole bunch of affinity groups, et cetera. And so I think that our students have felt incredibly, incredibly welcomed at our school. And so I do hope that you will apply to our school.
Okay, going on to our next question is, does the medical school have any programs to help Kaiser employees get into medical school?
Great question. No specific programs, but I will say that one of the things, and I think Agasia can attest to this, though there is nothing preferential, right, that goes into getting students into the med school because they've worked at Kaiser or they've done internships at Kaiser. I will say that, whenever our admissions committee sees letters from, folks who are from Kaiser and they've written on behalf of the student, I will say that that often enters into the conversation, right? But we don't have any upstream ways of, being preferential toward folks who've worked for Kaiser Permanente. So I hope that that provides some clarity.
Yeah, I would say for me, I do receive emails sometimes from Kaiser employees and employees that happen to be parents to people who are interested in medicine, and I definitely do pay attention. I probably would say I would probably respond a little bit more quicker and just offer them to just join me at one of our upcoming events. So I don't like to treat them any differently, but I do make sure that I want to give them as much information as possible to get them on the right track. So I would probably say that's where that may be a difference. But yeah, I just want to make sure everybody is getting the same information.
And our next question is, can you give an example about how the EID aspect of the curriculum manifests in the case-based patient-centered learning?
Oh, I love that question in so many ways. So I'll start by saying that we have a faculty director of inclusive curriculum, and that person's role really allows us to look critically across the board in every curricular space. And a couple of the things that are all kind of innovative at the school. One is, before we even share any of the teaching decks with the PowerPoints with our students, all of the case vignettes that I mentioned earlier, we try to make them as kind of real life as possible. We filled out something called a clinical tracker, a patient tracker. And what we've done is every case that's used to teach our students, the cases, the persons reflected in the cases reflect the population of LA County, right? Which it's kind of the clinical spaces that students are in. We also try to ensure that we are not misgendering our patients, that we're paying attention to issues of sexual orientation. We try to ensure that our students have a deep understanding that race is a social construct. And so we think of our curriculum, or we engage in a race conscious way, not a race-based way. So these are conversations we're always having with our students. Another area of our curriculum that we've paid close attention to is we have a medical illustrator. And I went to med school in 1988, and none of the images that were used for teaching, right, the illustrations looked anything like me, frankly. And now we actually have a medical illustrator who has ensured that there's good representation across the board for the images, the illustrations that our students are learning through. So we've been very robust in how we develop our cases. And then lastly, we have an EID curriculum work group. So that group meets twice a month for about an hour, hour and a half. And they are always reviewing all of the slide decks, all of the materials, that manuscripts, videos, anything our students are going to be learning from, those are all reviewed for EID content, for, process. So it really is a pretty, we've developed a really intensive approach to an inclusive curriculum. I hope that's clear. And if it's not, I'm happy to answer any follow-up questions you may have.
I think that was very clear. We'll see. Maybe they'll put follow-up questions in the Q&A. For now, does a student's choice of major impact their admission?
Acacia, you can take that one.
Absolutely not. That's an easy question. No.
I thought you would love that one.
Your major does not make a difference. You could be a science major. I think it probably makes it easier on you in regards to prereqs. But if you are a non-science major, you are still in great company. As a matter of fact, I think a good probably 30% of our cohorts, I'd probably say 25-30% of our cohorts are non-science majors. And personally, and now I'm putting on my former academic advisement hat, I would rather see you thrive and do very well in a non-science major and take your prereqs and do very well in those versus, struggling in a science major that you're not really certain about, So it really just depends on the person. I want you to take something or major in something that you really, really love and enjoy and do really good at it. Advisor / admission counselor.
There you go. I like the combo.
These questions are great. I'm literally trying to answer as many as I can.
Amazing questions. Wow.
Yeah, we have a lot of really great questions.
I'm trying. I'm typing as fast as I can.
Just amazing, really.
We have another question. So our former community college students at a disadvantage for getting admitted, and is there a lower admissions rate for them?
Can you repeat that, Madeline? I'm sorry, I didn't catch that.
Are students who went to a community college, do they have a lower rate of admissions than other students?
Oh, I see what you're asking. I would have to actually look into the actual data for that and see how that is reported out. I believe the AAMC does, in fact, parse out that data. So I don't want to say, in an affirmative way they do or say they don't. I think that's data that, we need to look back at. I will say that at our school, and I think there was a form of this question earlier, that we do everything in our power to ensure that we are not disadvantaging students who have made a different choice or have gone a different route, right? We recognize that everyone has a different start. We know that people go to community colleges for a whole host of different reasons. And, I think that when we started our admissions process, that was an early commitment that we made. And I will say it also is part of how we've trained our admissions faculty. So folks who are reviewing your applications, they are trained to look at community college grades in exactly the same way as they would a four-year university.
That's wonderful. I'm sure many of our students are relieved to hear that.
Absolutely.
Our next question is, what goals does Kaiser Permanente School of Medicine have for advancing their medical curriculum or their program as a whole in the next 5 years?
Yeah, I love that timeline, because in the next 5 years, we would already have had students who've graduated who are in residency programs. And we often say to ourselves, if we have kind of lived up to the mission and vision, core values of the school, I think that our students are going to be out there in their residency training programs, doing all sorts of amazing things and pushing boundaries and that kind of thing. So I would imagine that by then we may have expanded our class size. Perhaps I suspect that we would, without giving any specifics, that we would have built out our curriculum and made the appropriate tweaks to it as informed by students who graduated. The beauty about having a cohort by then actually there will be 2 cohorts who graduated, is that they will serve as we track their progress to inform a lot of the work we are able to continue to do as a medical school.
Great answer.
Mm-hmm.
Our next question is, what is a typical schedule like for a Kaiser medical student? And that they've heard that students have a mentor throughout their years. And could you tell them a little bit more about that?
Yeah, so the students are so the first year students, which I think for most on the call, that's probably the year that tends to be the one folks want to hear the most about. They typically will have Monday, Wednesday, Thursday, Friday afternoons off. And I had shown a little bit of a schematic of that where it said independent time on the bottom. And usually during that time, they may be going to affinity group meetings. If you're part of LMSA or MedPride or what have you, you may have a couple meetings in the afternoons, but a lot of our students are studying in the afternoons. They're not in class usually, except for Tuesdays when they are doing health system science stuff, right? They're typically in class, Monday through Wednesday, and then again Friday mornings, and that's when they're doing the small group learning. So they're typically doing anatomy, they're doing they're doctoring courses, they're doing what's called the Foundations of Health courses, and all of those are integrated. And then on Thursdays, they're going out to clinic. So Thursday mornings, the students are all going out to their respective clinical sites to work, either with their with their family medicine preceptor or their internal medicine preceptor. They do have a physician coach. So they have a person who is with them the entirety of their 4 years at the medical school, where they're working on developing their professional identity. That person also reviews their academic portfolios with them with some routine cadence, and they kind of work out their individual learning plans. And then they sometimes will have specialty mentors. So a lot of our second year students already have specialty mentors. If people want to be orthopedic surgeons, they may have an orthopedic surgery mentor, to guide them along in terms of that particular specialty.
Thank you. And our next question is about the small group learning. And they were wondering, could you elaborate a little bit more about what that entails? And is there a professor that's teaching 5 to 10 students at a time, or how is it guided?
Yeah, great question. Usually there are about 8 students per classroom, and there are 2 instructors per 8 students. So really great ratios. One instructor is a biomedical scientist, so a PhD person, and the second instructor is a practicing doctor. It's a, you know, it's usually a physician from Kaiser Permanente, and they are with those students in a small group learning environment where the learning is very active. So I'll give you an example. If the students are in their cardiovascular disease block where they're studying the heart, they will have a case of, I'm making this up, someone who presents with chest pain and, you know, they're taking blood pressure medication, and they unpack all of that. And the biomedical scientist, the PhD person's job is to really go deeply into the pathophysiology of the heart, you know, talk about the anatomy of the heart. The students, as I demonstrated earlier, will do some work in the Anatomy Resource Center. And then the clinician facilitator, right, the physician who is a Permanente medical doctor, will probably go through EKGs with them, right? They will demonstrate how EKGs are read. They will, you know, discuss that particular patient through the lens and perspective of a doctor. So the wonderful thing about that is the skill sets are complementary. And so the students are always learning very granular basic science, but at the same time, they're also learning how a patient with that pathophysiology may present, may come into the clinic, what the symptoms would look like. And then added to that, when they go to the health system science, team-based learning, and those are typically larger group settings, the students may learn something about why certain patients are at higher risk for heart disease. They may learn about the economics of medicine, you know, including the challenges if you're uninsured or underinsured. So it's all very much integrated, and we try to utilize one case vignette or scenario, a patient's story, to unpack all of that. I hope that's a little bit clearer. It's a really wonderful way to teach and learn.
That sounds great.
Mm-hmm.
And one of our next question is, could you please talk a little bit more about the multiple mini interview process and what's expected in that format?
Yeah, absolutely. And I think I'll ask Agasia, would you like to give that one a start?
Sure, as I'm furiously typing away.
Right, sorry.
No, it's okay. I was like, wait, what? So
Yeah,
our interview process, multiple mini interview, that's what MMI stands for, means that you are going to have several, think of them, I always kind of connect it to like speed dating, but you are going to have a series of interviews with an interviewer, and you will be given a scenario. You usually get about 2 minutes to read the scenario, and it could be on a particular theme. So the theme could be about diversity or social justice, something along that line. So 2 minutes to read the scenario, then you connect with your interviewer, and you have 7 minutes to discuss the scenario with your interviewer. And then once you're done, you go to the next MMI station, for example, and you do that for about 6 times or so. We also have a hybrid approach. So we have a one-on-one traditional interview. So your MMI interviews are considered blind, meaning that that interviewer has not had access to your file. So you have about 5 or 6 times to make really good first impressions. And then your one-on-one interview, that actually is an open file interview, meaning that the interviewer has had access to your file, and they may ask you questions from your admission file. All of that takes place in a matter of about 2 hours or so. But yeah, it gives us a better idea of how you think and how you react critically. And it is a fun moment. And I actually had something similar for my own interview process and walked away thinking, wow, I am in awe of every applicant.
Yeah, that's a great description of it, Agasia. The only thing I would add is that really from the student's perspective, we think it provides a much fairer way and more equitable way to assess applicants. You know, when you only do a one-on-one interview, you're kind of at the mercy of whomever you engage with, right? When you're able to be seen by a whole host of different people, then, you get to have sort of different people with whom you've engaged who can then report out on different aspects of you. So we've done it and schools do it in a standardized way. So it really allows a lot more equity to the process.
And our next question is, how does KPSOM help prepare students for the STEP exams with regards to resources as well as time to study?
Great question. I'll start with the time to study, because the students will have a nice amount of time to prep, actually set aside to prep for the STEP exams. The other thing I'll point out, and this was done actually even preceding, you guys may know that the Step 1 exam is now pass fail, and even preceding arrival to the school by our students. One of our basic science instructors, he's actually the chair of the Department of Biomedical Science. He had mapped out the entire curriculum to the kind of learning objectives in on Step 1. So that was just serendipitous that he had actually already done so. So we think that the content we have put in place for you will provide you just incredibly rich opportunities for that. The other thing our students will do is we have different times in the curriculum whereby they're going to be taking kind of practice STEP exams. So they will have kind of a starting point in terms of just a baseline in terms of where they are. And then lastly, I will say that all students will be provided with robust study materials. We recognize that at some schools, it's often the students who are more advantaged who get to have all the fancy resources. And we've really taken that piece of it out of the equation such that you will be provided with those resources by the school.
That's great to hear. And our next question is, for students that are parents, will the school provide insurance for their immediate family as well?
Yeah, great question. And I'll have to pitch that one back at some point to our Senior Associate Dean for Student Affairs. But I do know that we have students who have partners or are married and they have kids and they're covered by health insurance. I don't think it's covered though by the school. I think that there may be, I don't know if there's a special rate that those family members are provided. I know they are covered, but I do think that the students do have to put forth some amount of money toward that. But we can certainly follow up on that with our Senior Associate Dean for Student Affairs and get back to the group, because I think that's a wonderful question as well.
And the next question is, how would KPSOM view applicants who had to retake the MCAT multiple times?
Great, that is a wonderful question. So just a couple general comments about exam retakes. I think the majority of students we see have taken the MCAT score more than once. So I will start by saying that I don't know that it necessarily is the majority. That may have been an overstatement, but a very significant number of students who apply to our medical school have taken the MCAT more than once. So I'll start by saying that I often will say to pre-med students who I advise that I think anything over 3 may begin to look a little bit different to schools, and they may be thinking about your candidacy a little bit differently. So what I say to students is a retake is fine and 2 retakes are fine, but do ensure that you are identifying your areas, right, whereby you need to do a little bit more work and really work on those areas preceding retaking the exam. Okay, so that's the first thing that I often will say to students. The second thing is don't retake the exam that closely to the first time you took it, right? Or if you're taking it a third time, to the second time you took it. And the main reason for that is it's unlikely that your score is going to change a whole lot within a couple months. So I will often say to students, give yourself a minimum of 4 months and ideally about 6 months before you decide to retake. Sometimes I see students who've taken the exam 3 different times and they're a month apart. Okay. And then it's not that surprising that your score hasn't really changed a whole lot, right? And in fact, sometimes you run the risk of getting an even lower score. So I would ask that you be really mindful and kind of thoughtful and really unpack things carefully with your mentors or your advisors before you sign up yet again for an exam. And they're pricey. I mean, retaking exams, it's not trivial, right? So as you're thinking about it, just also think about the cost piece and that sort of thing. So.
But I do repeat, do not take the MCAT just to practice to see how you're gonna do.
And that I could not agree with you more. That is not the time to practice. You practice on practice tests, not on the MCAT. Okay. And please don't take the MCAT as a baseline. I've had students who say, well, you know, I took it my sophomore year for a baseline. And I'm like, that's not what you want to be doing. I couldn't agree with you more. Thank you for that. Yeah.
And also, if let's say that day you wake up and your dog dies and on the way you get in a car accident and somebody cuts you off and then you trip and you break your ankle, don't walk in and take the exam. You could cancel it too.
Yeah, great call out. Thank you for that. Yeah, all of the above.
Our next question is, could you tell us, what types of student organizations have been founded on the basis of patient advocacy at KPSOM?
Great question. So we have quite a few. We've got I think if you look at the work of the Student National Medical Association, there's a lot of advocacy there. The Latinx Medical Student Association. We've got a women in medicine group. Occasionally, you're gonna have to help me as I'm forgetting all of them.
MedPride.
We've got, thank you.
MedPride. I think there is a Women for Restorative Justice or Reproductive Justice.
Very active group.
Very active group.
Yeah, there's one that's not yet started, but I know that we have a group of students who are deeply passionate about homelessness and houselessness. And Joven, you're writing it in. Thank you.
Thank you.
Appreciate that. Yeah, it's a very, very active.
If you're savvy on this cool thing called Instagram or Twitter,
gram.
you could find them.
Yeah, the gram. So yeah, and groups at our school are not they're not hard to come by. It's and just so that if you are someone who comes to the school with a particular interest, for example, we've got a couple of students who are going to be forming also a first gen group. And, and so if you're someone who's passionate about a thing, typically, if you can find a few people, usually about 3 to 4 folks, you can usually kind of start your group up. So, and we're new, right? So there's a lot of opportunity for there to be even more advocacy groups. A wonderful question.
And our next question is, can you tell us more about global health programs and opportunities that are available at KPSOM?
Great question. I will start by saying we have a wonderful global health director. I'm sure everyone's aware of Dr. Paul Farmer's passing, and Aaron Berkowitz, who was a protege of Dr. Farmer's, happens to be our global health director. And it's a program that's still being built out, and our students will begin to do some global health work, typically right at around the 4th year, a little bit in the 3rd year, but primarily the 4th year of medical school. I think we currently have sites in Mexico. We have a site in Kenya, and I'm forgetting the 3rd site. But I do know that that work is being developed and ongoing.
And then our next question is, will working or having a job qualify as personal experience towards being accepted as part of the holistic approach?
Great question, and absolutely yes. So that's where we talk about where one begins in life, every student's unique lived experience, their distance traveled. We know that there are students for whom work is not just, there's no choice. You have to work. And we absolutely take that into account when we are reviewing your application and when we're looking at those experiences. So as you're documenting your experiences, please make certain you're documenting your hours of employment. There's an area, paid employment. Please make certain you're documenting that, because that too is taken into account.
And then our next question is, somebody would like a little bit more clarification about the scholarly project and what it entails.
So the scholarly project, I'll start by saying we've allowed students a lot of flexibility, right? So you can be somebody who has an interest in, inequities in health as it, pertains to maternal health. I'm just giving one example, and you can decide that you're going to do a thorough literature search on that topic, and you can write up a report of what you found. So that's the extreme of something fairly simple you can do as a scholarly project. So the reason we even have it is in order for students to exercise kind of that whole power of inquiry. Like, we want our students to be inquisitive about stuff, right? But you can also do something as intense as, some kind of bench research at Caltech or at another institution, or you can utilize some of Kaiser Permanente's clinical data, which are the folks in the Office of Research and Scholarship have recently downloaded to the school, and do data mining, right? You can do a lot of that's another place you can actually engage in disparities or inequities research. So again, there's a broad range of projects that qualify as a scholarly project. I hope that's a little bit clearer.
I think that answered. And then our next question is, many students who transferred during the COVID-19 pandemic had difficulty finding research. How does KPSOM view students with minimal or no research experience?
Did you want to try that one, Acacia? And I'm happy to follow up if you would like. Or...
So we realized that COVID-19 definitely affected everyone. It's especially in regards to, students losing their research opportunities, volunteer opportunities, and their shadowing opportunities. And not only did our school realize that, but so did pretty much all schools, medical schools in the nation, to the point where many of the California medical school deans got together and created a pact, or, and said that we are going to make sure that our students are not being held accountable, or not accountable, what do I want to say? They won't be penalized for that, for not having that, because it's not your fault that you may not have those opportunities. And we made sure that all of our admissions committees are aware that some of you may not have as many hours as maybe those from previous years. So we understand, everyone gets it, and we just want you to try. I will say this, just because you probably wasn't able to do that in person, many students and applicants took the initiative and actually found other ways to get involved. There sometimes were opportunities to do things virtually, or maybe they just decided to, take part in things that popped up because of COVID. So we had students become contact tracers, and we're actually assisting with COVID clinics. So we were seeing a lot of people taking the initiative and jumping in and helping out where they can. And we love seeing things like that.
Yeah, just to make a plug, we actually did almost a 2-hour presentation on clinical opportunities during time of COVID. And there's a lot of information about contact tracing and stuff that you can do through COVID. And I think with COVID has created a lot of opportunities. So recommend people watch that. Making a shameless plug, of course.
And then our next question is, somebody was wondering if they qualify to apply as a disadvantaged applicant on the AMCAS application and submit a statement of disadvantage through that. Will this decision alter any consideration given to their primary application?
Not at all, if I'm understanding the question. So is it that the person would have listed not disadvantage on the AMCAS?
I believe it's that they listed that they were disadvantaged.
Oh, yeah, that and they are disadvantaged. Is that, yeah, I think that is perfectly fine. Absolutely.
And then our next question are there assessments given to test what the students have learned within the classroom setting?
Great question. So that's another, when we talked about what's distinct about our school, I should have mentioned our assessment of students. We have a pretty robust assessment system that is what we call competency-based. And what that means is that we are actually watching and assessing students in ways that our students are actually demonstrating to us what they've learned, right? So it's not just having them, they are doing multiple choice questions and open-ended questions and those sorts of things, but a lot of the ways in which we're assessing their clinical acumen and how well they're doing clinically is based on a lot of expert assessors, expert clinical assessors. So that's certainly a piece that's very much that has been added to our assessment approach. The other thing I should point out is that the first 2 years, any kinds of assessments in the classroom end up in a pass or fail grade, right? They are not given letter grades. And then once they go out to the clinical spaces, then it's honors, pass, fail. But we don't have letter grades and it's all pass, fail. And for schools who've moved from a letter grade assessment, or letter grades, I should say, to a pass, fail approach, one of the things we've seen is that the students are significantly more likely to collaborate with each other. There's less of that competitive feel, to the environment. I hope that answers the question.
I think it does. That was a great explanation.
Mm-hmm.
Our next question is, as a high school student, what do you think the most vital steps after high school are when attempting to enter a medical career?
Keisha, do you want to take a stab at that one?
I get this because I get parents that ask me about this all the time. I would say definitely, obviously keep your grades up. We want you to have really good grades because you're going to need to take that with you and have good study habits. You need to formulate your study habits early on because you're going to need that in college. Once you get to college, you probably would want to connect with a pre-health group or look for the pre-health advisors. Pretty much most schools have like a pre-health office and get in contact with them, and they will put you on the right path and track to get you ready for applying for medical school when it is time. So I would probably say that's the best thing I would look for as a high school student. You are going to go into college knowing that that is the track that you want to be on. And you have to do that early because there are a lot of classes that you need to take in a series and be prepared. So that starts freshman year even.
Yeah, I am so shout out to you for thinking about all that. I totally agree with everything Agasia has said. And the other thing I would add, the only other thing I should say I would add is find a mentor or a couple mentors, right? But to Agasia's point, just kind of getting plugged in early to, kind of to the whole pre-med advisory group that can actually change your path and your trajectory just by getting just really good early advising. And then coming to events like these, where you're able to connect with a whole different, a variety of people, I should say, who can kind of give you the inside scoop. So definitely stay connected, but agree with everything Agisha just talked about.
Wow, you guys, those were amazing questions.
We have one last question for now. Are there opportunities for students to offer feedback to KPSOM, such as curriculum or for school programming?
Absolutely. And do they ever? One of the things I think we're proudest of is that our students really do have a voice. We have student representation on just about every committee at the school. The other thing I will say from a feedback perspective is we have these QR codes in the classroom. So we actually get feedback from students in real time. So we definitely don't lack getting feedback. The other piece, though, I should point out is we've already acted on some of the feedback we've gotten from students, which really has kind of changed the curriculum a little bit very early. I would say the first 6 months of our school opening up. One of the things our students said to us was, look, there is just a lot of pre-work. I mean, is there a way we can condense that a little bit? And all of the course directors kind of put their heads together and they really shaved off a lot of hours, right, from the pre-work the students were doing. The other example was, I showed you that blank, that independent study time on Wednesday afternoons. If I had given this talk a year ago, it would have looked different. The students used to have class on Wednesday afternoons. And they said, can we lighten up on one more afternoon? And again, course directors put their heads together and they said, sure, we will try to move things around. And in fact, they did. And the students now have that additional afternoon, that's Wednesday afternoon. So they do give feedback. We welcome their feedback and we act on their feedback anytime we can. So thanks for that question.
Do we have any last questions? You guys, everyone's welcome to put them into the Q&A box.
What an amazing group. Wow.
Thank you so much, Dr. Wiley-Jacobo. Oh, here we go.
Oh, do we have one? Good.
We have
awesome.
We have a thank you for the wonderful presentation. Thank you, PreMedCC, for hosting the event. Thank you so much, Dr. Wiley-Jacobo.